I didn't know why people didn't want to be around me.
My ADHD affected my ability to make and keep friends.
I remember crying in middle school because my brother kept having his friends invite him over, and I hadn't been invited to a friend's house in months.
It seems to pervade every aspect of my life.
The story of my life is act and regret.
ADHD, or Attention Deficit Hyperactivity Disorder, is a psychological disorder characterized by impulsivity, excitability, hyperactivity, and distractibility. However, this description does not emphasize the daily struggles of individuals with ADHD.
Since the symptoms are behavioral, many people who are diagnosed struggle with distinguishing the differences between themselves and other people. The general lack of understanding about the symptoms of ADHD can lead to confusion and insecurity. They have less confidence in pursuing relationships or career goals and prefer to live within the constraints of their disorder.
Medications used to counteract the symptoms of ADHD may cause individuals to struggle with their nutrition. These drugs, categorized as stimulants, can also lead to depression and substance abuse.
A diagnosis is most likely to occur while the individual is in school, particularly when the student reaches the age at which it becomes unacceptable to throw a temper tantrum. Pressures to advance at the same rate as their peers have been known to provoke the symptoms of ADHD. For many, the lifelong journey with ADHD begins in the classroom.
Krista is my friend from school. We became friends when we were really little, but we didn't become really good friends till 6th grade on the playground. And then during sophomore year, we became even closer, and that's when she told me she had ADHD. Growing up, Krista would always be really loud at bad times. She'd make inappropriate comments in awkward situations, and then she never really understood why people would give her weird looks. I always felt really bad when people made fun of Krista for the way she behaved. I knew she had ADHD, but a lot of other people didn't know. She tried to keep it a secret because she didn't want to be judged. I remember Krista complaining a lot about her medication because it made her lose her appetite, but she knew she needed to eat. So recently she decided to quit taking her medication, so now she can eat more healthy and more often. And also now she's just learned to control some of the comments she makes, or getting really excited about stuff that she maybe should tone it down a little bit. But I think seeing her on her medication and then after her medication, I think I've seen some really good changes.
How do you be bad?
By giving attitude to my mom.
Why do you think you give attitude?
I don't know, sometimes I just get into moods. It depends on how good the day is.
Quite a big difference for someone that's got ADD and ADHD. So I've got ADHD, which means I can't focus, I'm impulsive, I'm very hyperactive, I'm constantly moving. The thing that for me when I was in school, I'm constantly moving. I can't, even now, I can't stand still. My piece of hair is really bugging me. I just can't stand still. And you just can't seem to get your head around, why am I doing this? Why am I like this?
You don't know what it's like to be inside my head. You don't know what it's like to try so hard to remember something you just heard, to focus on one thing when there's a million other things going on. You don't know what it's like to be so antsy that you look like a 4-year-old trying to sit still when you're 24. It's embarrassing, it's hard, and you trying to invalidate that by saying it's not real is not only offensive, but it hurts.
I felt dumb. I felt stupid. I felt like I was mental. I felt bad. And that right there is what started it all. The frustration, the anger, and to a certain degree the depression about not being able to kind of keep up with everyone else.
There is a large controversy surrounding what method of treatment for ADHD should be predominantly used in the future. Prescribed medications have had the greatest amount of success and are the most popular, despite other forms of treatment. However, there is a fear that these medications or stimulants may be suppressing the neurological and physical development of children with ADHD.
Well, it's good news and bad news. The good news is we're educating doctors more effectively, teachers, parents, and so more kids are getting the help who need the help.
Right.
The bad news is, in some places, it's overdiagnosed. Every child who comes in who's getting a bad grade gets diagnosed with ADHD, which shouldn't happen. Right. On the other hand, you have some doctors in some regions who say, I don't believe in ADHD, as if it were a religious principle, you know. Right. So what we want to do is educate parents, doctors, teachers effectively so that everyone who needs the help can get it, but those who don't need the help don't get it.
Scientists are working towards developing new forms of treatment that are less invasive than medications. As a result of this, doctors may soon be prescribing video games geared towards behavioral therapy instead of medication that controls the symptoms of ADHD. One program developed by the NeuroCog company is a computer-based treatment called BCI therapy. Essentially, it is a video game that requires the player to accomplish certain tasks. Patients are hooked up to a wearable electroencephalography headband that measures brain activity. If they become distracted, the game pauses. As a result, their focus and their ability to sort out which information is essential improves. As their focus becomes more developed, the game becomes more complex. Dr. Adam Gazzaley has developed another video game called Evo, which is currently undergoing clinical trials. This game appeals mainly towards children.
12-year-old Walter Amerbach watches closely as the frog on the computer hops. His goal, to keep the frog moving by paying attention. The sensors inside the helmet Walter's wearing monitor his focus. When that focus slips, the frog slows down.
The brain can be trained to alter its neural connections. Therefore, individuals with ADHD can train their brain to focus. The more these connections are used, the stronger they become. Since distractibility is one of the main symptoms of ADHD, programs like this would improve the quality of life immensely. Schools could even buy this program so that students diagnosed with ADHD would be able to take a class that dedicates an hour of their day to developing focusing skills to help the symptoms of their disorder.
Games like this would also serve as an archive for the progress the patient has made in their cognitive functions. Like the Fitbit, which keeps track of physical activity and records athletic progress, these video games would keep track of mental activity. Doctors would be able to receive daily updates on patients from this program in combination with meeting them throughout the year. This would lead to more detailed and attentive care.
The fact that this disorder prevents people from living their lives to the fullest should be distressing to everyone, even those without ADHD, which is why a solid and reliable method of treatment must be developed.
With the combination of technological advancements and therapy mentioned previously, people diagnosed with ADHD, especially children, will be able to achieve things that others take for granted. Everyone deserves a happy and full life, even if it sometimes seems like an unobtainable goal. Despite one's circumstances, every stride should be made to accord of them any and all rights and opportunities, which is why the development of ADHD treatments is so vital to our society.